Hello and welcome to our live telephone town hall meeting with California's 33rd Congressional District. Thank you so much for being on this live teletown hall forum with us today. We're going to be joined in a moment here by your Congressman, Ted Lieu, who of course represents you for California's 33rd Congressional District. He's got some updates for you and he'll provide an overview of the recent stimulus package, and then we'll hear from a panel of expert speakers as well. And once we're through that, we'll be asking for your questions. So if you have any questions that you'd like to ask about the stimulus bill or about COVID-19 and the public response, go ahead and push 0 on your phone now or at any time during this forum. Get in line to ask your question live. If you're not comfortable asking your question live, you should still press 0 to submit those questions for Q&A, and then you can just let your operator know if you want me to read that question over the air instead of bringing you up to ask it live. Whatever's more comfortable for you. Either way, we will be getting to Q&A in a few minutes here. Again, we're going to hear an overview of the recent stimulus package from Congressman Lieu, and then we'll hear from a panel of expert speakers. So as you're listening, be thinking about questions you'd like to submit for Q&A, and then as soon as you have a question to submit, go ahead and press 0, speak to an operator, give them your question, and then you'll have the opportunity to ask it live, or you can let your operator know if you want me to read it instead. Again, 0 for questions. One more thing, you can also press 7 on your phone if you'd like to get email updates from Congressman Lieu's office. So if you'd like to be kept better updated moving forward electronically as we move through this, go ahead and push 7 on your phone, give us your email address, and we'll keep you better updated in the future. Again, 7 if you'd like to get email updates from Congressman Lieu's office. We'll get you with one of our operators, get your email address, and make sure we keep you updated quickly and with accurate information moving forward. So that's 7 for emails. All right, we're still dialing out to California's 33rd Congressional District. Thanks for your patience. I'll go over this once more, then I'll turn it over to Congressman Lieu. Again, you're joining this live teletown hall with California's 33rd Congressional District. We're dialing out to tens of thousands of your neighbors. We appreciate your patience. We're just about to get started. This is an opportunity for you to learn more about the recent stimulus package. Congressman Lieu will be providing an overview, and then we'll hear from a panel of expert speakers. As you're listening, be thinking about questions you'd like to submit. You can press 0 to submit a question, and again, you can press 7 if you'd like to get email updates from Congressman Lieu moving forward. Thank you so much again for your participation in this live teletown hall. Let's go ahead and get it started. Turning it over now to your Congressman, Ted Lieu. Go ahead, please.
Thank you. This is Congressman Ted Lieu. I am so thankful so many of you are joining, and we're going to have this live telephone town hall. I'm going to give an overview of the laws that Congress has passed, and then we're going to hear from Dr. Rika Murthy with Cedars-Sinai Hospital. We're going to hear from Luis Campillo with the AARP, and then Victor Parker with the Small Business Administration. So right now, we're in very challenging times, and what I want you to know is that local, state, and federal officials are working together to try to address this pandemic and to make sure everyone is safe and to help America recover. Congress has passed 3 laws. The first was over $8 billion to provide a lot of funding for a cure, either a vaccine or a drug therapy that can mitigate COVID-19, also known as coronavirus. We also expanded the availability of small business loans in that first bill. We then passed shortly thereafter a second law, and that had a number of provisions. One of the most important was emergency paid leave. A number of large corporations already do provide that to their employees, but many small businesses did not. So this provided provisions for small businesses to give the emergency paid leave, and then they would get 100% tax credit from the federal government for reimbursement. And then just last Friday, we passed the third law. It's a stimulus package to address the many Americans who have lost their jobs and are otherwise feeling the effects of this economic downturn. And I'm going to get very specific with some of these provisions because you're going to see them affect many of you. So the first is going to be the direct stimulus checks. Any individual making up to $75,000 or $150,000 for married couples will receive payments of $1,200 with an additional $500 payment per minor child. The payments will then start decreasing up to a total of $99,000 adjusted gross income if you're a single worker, or $198,000 for married workers. And if you're a family of four, any income below $218,000 will get some amount of stimulus. And that money will be issued directly by the IRS via direct deposit. And it'll be based on either your 2019 or 2018 tax returns or your 2019 Social Security statement. If for whatever reason you have not filed a tax return in 2018 and 2019 or don't receive Social Security benefits, then my recommendation and the IRS recommendation to you is to file a 2018 tax return to receive those payments. If you receive Social Security, retirement, or other social safety net benefits, you can also get a stimulus check as well. Happy to answer any additional questions, but those should be coming to you in a few weeks. In addition, the law that was signed last Friday, which, by the way, is bipartisan, also greatly expanded unemployment insurance. It was something that Democrats had pushed for very hard. It's going to expand it to gig workers and people who are in non-traditional jobs. We also increased the unemployment by 13 weeks, and we provided additional amounts per week. Depending on the state, it will be anywhere between a little over $400 additional per week to about $600 per week. I believe California is a little over $400 additional per week. In addition, we provided a range of funding to institutions and organizations that have had to deal with this crisis. So over $100 billion went to hospitals and hospital systems for them to get the equipment they need to fight this epidemic. We also gave $13.5 billion to schools and school districts to address distance learning and the effects of the shutdown at schools, and about $14 billion to institutions of higher learning, colleges and universities, because they have had to do the same thing. We also put a lot of funding for small businesses so that they can access small business loans. And then we also put in protections for people who currently have mortgages and are unable to pay them. So if you have a mortgage, either that is through the VA, or if it's through FHA, or if it's backed by Fannie Mae or Freddie Mac, then you can request forbearance on your payments for up to 6 months, with a possible extension of another 6 months without any fees, penalties, or extra interest. The way you do that is you should contact your mortgage service company directly. And then for those who are renters, if your rent is coming up due, or if you're in assisted housing, then and you're unable to pay the rent, then you're protected from eviction for 4 months. And if your landlord is not abiding by this moratorium, you should contact either our office or the agency that administers your housing program. There's a lot more provisions in the stimulus package. I'm happy to answer those, any specific questions you may have. And just want you to know we're working very hard to try to deal with this coronavirus pandemic. We're now working on a fourth bill that's going to try to create additional jobs through infrastructure, and also to provide additional relief to Americans who are suffering from this pandemic. So now I'd like to move to our first expert speaker. It's Dr. Rita Murthy. She is an infectious disease physician with expertise in healthcare epidemiology and is a member of the leadership team at Cedars-Sinai, coordinating the health system's response to the COVID-19 pandemic. She also is Vice President for Medical Affairs and Associate Chief Medical Officer at Cedars-Sinai. So Dr. Murthy, if you want to give a few comments, that'd be great.
Sure. Thank you very much. And on behalf of Cedars-Sinai, I'm very happy to be here with you virtually. And Congressman Lieu, I just wanted to extend on behalf of Cedars-Sinai my appreciation for your tremendous work in supporting the healthcare systems in this unprecedented global public health crisis, and also for your past support in dealing with infectious disease outbreaks, including not that long ago, device-associated outbreaks in hospitals. So with that, I'll just make a comment that I've been an infectious diseases physician and healthcare epidemiologist for over 30 years, and I've never imagined actually having to deal with something of this magnitude, such as we're facing, both as individuals as well as systems. And so certainly this is a challenging time. I thought I would start with just a few facts about why this particular illness with COVID-19 and this particular pandemic is so unique. So there's a few facts, probably about 6 items I would like to just emphasize as a backdrop for our conversation today. So first of all, this is a completely novel virus that nobody's experienced before. So there's no immunity in the population. And though it is genetically similar to other coronaviruses, this is completely different. And as such, there is no vaccine available, and there are currently no treatments available that are FDA approved or known to be effective. Secondly, it very clearly appears to be spreading easily in the community from person to person. Thirdly, it causes a respiratory illness, and the way it's transmitted is that when somebody has an infection, the virus is carried on little respiratory droplets that are expelled when somebody coughs or sneezes. And if you happen to be standing nearby or being nearby of somebody who coughs or sneezes, these droplets may land on your face, or you may actually touch a surface where the droplets may have landed, and subsequently touch your eyes, nose, or mouth. And that's how the virus enters the body and can set up an infection. The illness itself, as I said, is a respiratory illness, but the majority of people, about 80% or so, either have minimal symptoms or in case so mild that they may not even realize that they have COVID-19 illness, or they may have moderate symptoms such as fever, cough, fatigue, and in some cases, about 20%, it may cause worse illness, and they may result in a pneumonia and needing hospitalization in a smaller proportion, and of course, numbers that we're seeing, some individuals may have severe disease and require needing to be on a ventilator and supportive care and may not survive. Another fact is that the incubation period, or the time between exposure and developing the illness with this particular COVID-19 infection is longer than the typical period that we would expect with influenza or other viral illnesses. It can be 5 to 7 days, and the outside perhaps up to 12 days. So it's like a slow burn, and because of that, the potential for having acquired the infection may not be readily apparent for several days afterwards. So what we're seeing today in the rest of the world, as well as here in the U.S. and here in Los Angeles and Southern California, is a reflection of how easily this virus spreads and leads to the need to explain and have these public health measures that have been put in place to really slow the speed of spread. And that's the best chance we have to reduce the volume of new cases for 2 reasons. One, we want to be able to reduce the speed of spread so that as people are needing hospitalization, the healthcare systems are not overwhelmed and we're able to care for them. And to buy time to be able to develop the vaccines and treatments. And with the public health measures that have been put in place in Los Angeles and California, both social distancing and the safer at home measures, we have a fighting chance to be able to slow the spread and allow our hospitals, Cedars-Sinai and other hospitals, to gear up and prepare. Though we're managing now, their concern is around the significant increases in cases as has been experienced in other parts of the world. So I think the final message is that we need everybody's help, and our goal is to prevent the spread, and we need everybody's help to do that, and that means staying at home, washing hands, and really practicing excellent hygiene and taking care of oneself and each other. So I'll pause there and hand it back to Congressman Lieu.
Thank you, Dr. Murthy. Really appreciate it. And just wanted to do a quick clarification of what I said about unemployment insurance. I think maybe I confused people. So right now in California, it's $450 per week. You then get an additional $600 on top of that because of the stimulus bill. So it will essentially be $1,050 per week for unemployment insurance for 4 months. and again, happy to answer any questions on that specific issue. And then next, we're going to hear from Louise with AARP. And I do note that he has done a lot of great work, and he also serves as a voter education 2020 census lead for AARP California. So I'm going to just do a quick digression here. Today is Census Day 2020, April 1st. So if you haven't filled out your census, please go ahead and do that. It'll only take you a few minutes. And the estimates are that for every person not counted, the local community loses $2,000 per person per year. So over 10 years, that's a $20,000 loss per person. And that federal funding goes to a number of organizations and programs, including schools, hospitals, first responders, and so on. So make sure you fill out your census. Now, back to Luis Campillo. He is the Los Angeles Regional Manager for AARP California, and he leads a cross-functional team focused on positioning AARP as a trusted resource and leader in local communities. And he's going to talk about not only the impacts of coronavirus on senior citizens, but also some of the scams that, unfortunately, we have seen happen during this pandemic. And with that, Luis, if you want to give a few remarks, that'd be great.
Thank you, Congressman, and thank you so much for convening this call, and again for your work and leadership on behalf of your constituents and all of Californians in Washington, D.C. So AARP, a nonprofit, nonpartisan member organization, has been working to promote the health and well-being of older Americans for more than 60 years. And in the face of this crisis, AARP is providing information and resources to help older people and those caring for them protect themselves from the virus and to prevent it from spreading even further. AARP has set up a page with information on coronavirus and resources at aarp.org/coronavirus. In addition to sharing information and resources, we are also advocating for the 50+ and their families at all levels of government to make sure that their needs are front and center as we continue to navigate these challenging circumstances. To date, and as the Congressman mentioned earlier in the call, we have supported the bipartisan advocacy efforts in Washington, D.C. and across the country. Our advocacy efforts have helped secure funding for healthcare providers to address the crisis. We have supported efforts to increase paid sick and family leave, work to have greater access to telehealth for people on Medicare, and to increase access and affordability to healthcare. AARP is also working to inform the public about potential frauds and scams, since unfortunately scammers are using the headlines as opportunities to steal money or sensitive personal information. Just yesterday, the governor announced a partnership with AARP and the California Department of Aging that will be publishing the California for All resource card. This will be a one-stop COVID-19 information guide for all Californians, but especially for older adults, as part of the campaign of Stay Home, Save Lives, Check In, which urges all Californians to help combat social isolation and food insecurity among Californians who are over the age of 65. With a large volume of information currently bombarding us, AARP identified the need for a single, trustworthy resource with clear guidance on where to get the most up-to-date information on COVID-19, where to find community resources, how to avoid scams and frauds, as well as how to stay home safe and get caregiving support if you need it. And lastly, AARP remains vigilant to the updates and recommendations provided by local authorities. We recommend that the public do the same. Listen to your local authorities, to the county and state health officials for instructions, and pay attention to their recommendations. And with that, I really look forward to answering your calls and to the rest of our conversation this afternoon.
Thank you so much, Luis. Really appreciate it. Next, we have Victor Parker. He is with the Small Business Administration. This last stimulus package provided over $370 billion for small businesses to help them during this crisis. And Victor is going to talk to you a little bit about how that can be accessed and exactly how business can apply for that. And so with that, Victor, why don't you go ahead?
Great. Thank you, Congressman, and thank you for again setting this up and making sure that we're getting all the resources out to our small businesses. Again, I'm Victor Parker with the U.S. Small Business Administration. I'm the Los Angeles District Office District Director. And thanks to the Congressman and the bill that was signed on Friday, we are now going to be able to administer a new loan program designed specifically for those businesses that have been impacted by the coronavirus. And this loan program will be traditionally like many of our loan programs that we do at SBA with our lending partners. So your traditional banks, credit unions, et cetera, will have access to this loan program that you work with each and every day. And this program is designed to do a couple of things. Number one, it's really designed to provide business owners with resources that they can continue to pay their employees during this pandemic. And so the Payment Protection Program will be, as they call it, often you will hear it called to as PPP or the PPP program, will be administered. It is a program that will offer up to $30 million for those businesses that will need to have access to funds to sustain their business during this time frame. There are a lot of nuances with it, depending on your current structure of your business, how many employees you have, and what the current status is of those employees. But we're looking forward to having those businesses, again, access that program through our SBA participating lenders, and you'll be able to go on sba.gov/coronavirus, and that portal should be live. We're getting everything set up, and we anticipate that being live no later than Friday when you'll be able to navigate that. Many of your banks that are out there now are currently taking what I'm going to call pre-applications for those folks that are interested in that program. And so I encourage you to please reach out to your lenders, your current lenders that you are working with. If you do have questions, you may also look at the website or reach the Los Angeles District Office to get some additional information about which lenders are participating. Secondly, and I'd like to also add, we're also running a parallel loan program prior to the package that was signed on last Friday by the President, and that is our Economic Injury Disaster Loan Program in response to the coronavirus. So that is a program that offers up to $2 million for small businesses that have been, again, impacted by the coronavirus. And so those are loan programs that are done directly from SBA, and you can apply for those now. So again, if you go to that same website, sba.gov/coronavirus, you'll be able to apply for that loan program, and that program will enable you to have access to funds to pay your fixed bills. So your rent, if you are a business owner and you have a storefront, it will help you with your payroll, any of your other bills that are in debts that you have on a normal basis. Again, it's not designed for you to expand your business, but it is designed to make you whole, if you will, to make your business whole based on the projections of what you would have been making or earning as a business owner prior to the coronavirus. And this is available to not only small businesses that are for profit, but also our nonprofit businesses that are in the community as well. With that, I will turn it back over to you, Congressman. I want to leave enough time for questions, and then we can go into details specifically as it relates to these questions that may come up. Thank you.
Thank you so much. And now why don't we open it up for questions?
Absolutely, Congressman. Thank you. And thanks, everybody who's submitting questions. A reminder, you can also sign up for email updates from Congressman Lieu's office by pressing 7. If you haven't already done that, I know a couple hundred of you already did, but if you didn't get a chance, you can press 7 on your phone now. Talk to one of our operators, give them your email address, and we'll keep you updated with accurate information moving forward via email. So again, 7 for emails. We've got our first question coming from Phil in Segundo. Phil, you're live. Go ahead.
Yeah, hi. Thank you for all of you for giving the information that we can certainly all use. My question for Congressman Lieu is this money we're supposed to receive, the $600. Is that through unemployment insurance, or is that through the stimulus package? And we would anyone who would receive that would receive it at a different time frame than, say, the unemployment checks?
Thank you for your question. The $600 is additional money for unemployment insurance. And so right now, California, it's $450 per week. With this additional $600, a person who gets unemployment insurance will essentially get $1,050 per week for 4 months. Separate from that, anyone whose adjusted gross income is less than $75,000 or $150,000 if married will get a direct stimulus check of $1,200 plus $500 per child. And then the amount of that check will decrease for people who make up to $99,000 if single or $198,000 if married. And that's a separate program from the unemployment insurance.
Got it. Thank you, Congressman Lieu. And thank you, Phil. Appreciate your question. Let's get another one up right away. We've got Gary in San Pedro. Go ahead, Gary.
Yes, my question is, there are a number of small businesses, such as restaurants, who are uncertain whether they will be able to reopen at any time and are not in a position to take out loans. Is there any economic assistance on the way, such as an outright grant rather than an SBA loan?
Victor, you want to address that, and I also have some thoughts afterwards as well.
Certainly. So as a part of the Economic Injury Disaster Loan Program, there is a clause in that program that will allow you to actually have what we call a forgivable portion of the loan, up to $10,000, depending on your payroll and what that looks like. So basically what happens is you would submit an application in for the Economic Injury Disaster Loan to start with, and then based on your current payroll, up to $10,000 of that loan would be forgivable if you show that you are using those funds specifically for your payroll. So they'll look at your current payroll and what it would be but for the coronavirus. So in other words, if you had 5 employees and now you've reduced down to just 2, they will look at it as if you were able to use those funds to retain the employees that you have, and that portion would be forgivable as a grant process, so to speak, in order to enable you to hopefully retain those employees, but it is forgivable, so you would not have to pay up to $10,000 of those funds back.
So let me just add a quick point. This is not the last law we're going to pass. This is going to be a continuing crisis, so we're already working on a 4th bill to try to provide additional relief and also jumpstart the economy. And so feel free to email me or give us ideas on how we can put in additional provisions to help those impacted by this crisis. So this is an ongoing effort in Congress as well as local and state officials to try to address the crisis. So if there are any gaps or things we've missed, we'll try to fix that in the next law that gets passed.
Great. Thank you again, Congressman Lieu, and thank you, Mr. Parker, for the answers. Gary, thank you very much for your question. Great question. Let's get our next one up right away. Let's get Donna from Santa Monica in line next. Hey, Donna, you're up. Go ahead, please.
Hi. I'm a little confused on the stimulus check. I've been keeping up with my reading, and by the way, thank you, Congressman Lieu, for everything that you do. It's greatly appreciated. I did file a 2019 return, but I didn't get a refund, so there would have been no reason for the IRS to have my bank account information. But I do receive Social Security. Will there be some cross-reference between the two?
Yeah, that's a good question. Louise, do you know the answer to that?
Yes, my understanding is that because you do receive Social Security, you will also get a stimulus payment as well, and that's part of what ARP fought for and advocated for as the package was being considered, understanding that those on Social Security and other vulnerable populations really needed that direct assistance from the federal government.
Now, if you believe you're entitled to a stimulus check, and if in a few weeks everyone is getting it and you are not, please contact our district office and we can help look and assist you with that issue.
And Congressman, if I may, I think that as we think about the expected payments, I really want to caution everybody against anybody contacting you pretending to be from the Social Security Administration, from the IRS, wanting to know your account number or wanting to get information that can be used to steal your identity at this critical time or to steal that deposit. So really be careful when you get a call that you really don't trust. Like the Congressman mentioned, it's better for you to contact the office, to contact the Social Security Administration. And we also at ARP have a Fraud Watch Network helpline. So if you get a call, you're welcome to call 1-877-908-3360. And there they can help you report or advise you as to what to do if you are concerned about a fraud or scam that you were contacted with. And more importantly, we're encouraging the public to report those scams so that way we know the type of questions and the type of schemes that are out there to try to defraud you from your much needed funds at this time.
Excellent point, Luis. Thank you so much. And Luis, can I read that number back to you for AARP scam reporting and make sure we got it right? I've got 877-908-3360.
That's correct.
All right. So if anybody out there needs that number again is 877-908-3360. If you believe you've been the target of a scam, you can call AARP. Thanks so much, Luis. And thank you for the question, Donna. Really great question. Let's get our next one up. We've got Michael. Hey, Michael, you're live. Go ahead.
Hey, Congressman, thank you so much. All the guys, you guys are working. You're really on top of this, so appreciate it. I'm self-employed, have been for probably 20 years. I run an advertising production company where I serve businesses in the community. I'm not able to go out and work because people aren't there, and there's just the 6-foot rule and all the stuff we're trying to do. So I'm out of work. Filed my taxes the last few years and all that stuff. But when contacting unemployment, they're pushing me back because they're saying I'm self-employed and I cannot receive unemployment. Is that true? And is there something we can do about that so that when I go about the process of filing that I could be clear about that?
The intent of the law Congress passed last Friday was to expand unemployment insurance to people who were self-employed and gig workers and others in the economy that were not traditionally employed. Now, the rules do get somewhat complicated. So after this call, we'll have my district office reach out to you and work with you on your specific case. But the intent is, in fact, to cover people in your situation. So we'll have one of our office staff work with you on that issue.
Perfect. Thank you so much, Congressman. Thank you, Michael. Really good question. Appreciate you asking it. We've got our next one up from Martha in Palisades. Martha wanted me to read her question, though, so I'll go ahead and do that. She's asking, the president has denied open access to the Affordable Care Act, ACA. What can you do to change that? It seems criminal. What can we do? Congressman, you got an answer for Martha in Palisades, please.
Thank you, Martha, for that question. So unfortunately, the president did deny enrollment right now for the ACA in the middle of a pandemic. I personally think that was an unwise move, and that's because if you don't have insurance and you get sick, guess where you're going to show up? You're going to show up in the emergency room, and that just puts additional pressure on our hospitals, and we can try to put additional pressure on the executive branch to allow the enrollment to happen. I think what we've actually seen happen is that pressure does work, and so for a long time, the president was unwilling to invoke the Defense Production Act to make sure we get ventilators and protective equipment out to hospitals. and now he has invoked it, but that took a few weeks of pressure. We have also seen the administration reverse on some other issues as well, given public pressure. So the only thing we can do now is to try to put additional pressure on the president to see if they will, if the executive branch will allow enrollment for the ACA. Because in the middle of a healthcare pandemic, what you want is as many people insured as possible. And while I'm on that point, Dr. Murthy, if you could comment a little bit about at least what you're seeing in LA County and Cedars-Sinai in terms of ventilator capacity and protective equipment, that'd be helpful.
Sure, I'd be glad to do that. So one of the concerns, of course, is that there is capacity at the moment in many of our hospitals, including Cedars-Sinai, to care for the patients we have now. And the concern is that with the potential surge that might occur, and there are some models out there that are available to the public, you can view them, that if you very quickly, as we've seen happen in some of the other locations, such as Italy or New York, where the existing capacity may be overrun if we don't slow the spread of disease. So we have the benefit of having some lead time compared to what New York has experienced, that we may be able to have an impact with these social distancing measures. And there's active efforts underway to be able to secure additional capacity, as well as supplies and ventilators and machinery to really for those contingencies. So we have a couple of examples. We have the U.S. Navy ship Mercy that has docked in the port of LA that is available to transfer patients from hospitals who don't have COVID or who are not being evaluated for COVID. There are Cedars-Sinai we've put up tents outside our emergency department, as well as establishing locations in the hospital that is currently available since elective surgeries have been canceled. So existing capacity is being made available and preparations underway. And sourcing of additional supplies such as personal protective equipment is actively being done.
Thank you so much for that. And thank you, Congressman, for the answer to that last question from Martha. Thank you for your question, Martha. Appreciate your participation today. Our next one's coming from Edna in Manhattan Beach. We've got a couple of medical questions in a row here. Edna, go ahead. You're live.
All right. First of all, thank you, Congressman Lieu, and your panel. But my question is, does a mask protect the wearer as well as the people they might come in contact with?
Dr. Murthy, can you answer that question?
Yeah, I'm happy to do that. So it's a great question, and we get asked that pretty frequently. So in the healthcare setting, in the hospital setting, the use of masks is helpful for the healthcare worker who's taking care of a patient within a specific hospital room, for example, who has likely to have either a suspect or confirmed COVID case. For the most part, however, the mask is intended to cover the cough for the person wearing it. And so in the general public, it really is not necessarily helpful in protecting you, but it can help in covering your own cough and potentially transmitting it to others. So the other side of it is the fact that when you put a mask on and off, it can be easily contaminated. So it's important that if you do use a mask, that it has to be done in a safe manner, washing your hands beforehand, putting it on, and then washing hands before taking it off. But in general, the current recommendations are that wearing a mask in the general public is not necessarily helpful. There is new data developing, however, and that we're learning so much about this disease, and new data is starting to emerge. And I would just say that's the current recommendation. That might evolve as some of this data becomes available.
Thank you, Dr. Murthy.
Dr. Murthy, I just had a follow-up question on that. I know there's different kinds of masks. One is their N95 masks, and then there's the other ones that aren't as high of a standard. For the general public, does it matter which mask someone would wear if they were to wear one?
It's a great question too, and I would say for the general public, a standard mask that really just serves to contain your cough is more than adequate. And these N95 masks refer to a very specific standard of filtration that are intended to have a very close fit over the face of the person wearing it. It has to be in a hospital setting. We have to have special fit testing for that to make sure it really does nothing penetrates, and it's really intended to be used in rooms of patients that are being cared for in special isolation rooms where the air is vented to the outside and where they may have a high risk of highly communicable disease like tuberculosis or measles or chickenpox. So COVID-19 is not in that category, and so that's more, as I said at the beginning, it's more droplet-based. It's heavier droplets that tend to fall to the ground, and the higher risk is more if you're very close to somebody, like if you're very close within coughing distance or prolonged conversations, and those are the settings where these droplets might actually fall kind of either near you or on your face. So asking the person to cover their cough if they're coughing if they're ill is really the mainstay of using the mask. And in general, again, at the moment, social distancing is some of the premise for social distancing is around that 6 foot apart distance.
Thank you.
Thank you. Appreciate you, Doctor. Thank you so much. And great question, Edna. Thank you. Next one's coming here from Alessa in Venice. Alessa, you're live. Go ahead.
Yeah, hi. I also want to say thank you all for everything you're doing. My question is about people who have recovered from the virus. Do we know if those people have a natural immunity? And then if they do, would they be able to go back to work, or do we even have that much information yet?
So
Dr. Murphy, can you answer that?
Yeah, I could try, and I say that I could try is because exactly the third point you raised, that this is information that we're still learning from. While there's some data from the China experience to say that there are fewer cases of reinfection in people who've had one infection, and that suggests that there's some immunity and there's some evidence of that. What's not known is how long that immunity lasts. It could be short-lived. It could be a few years. We don't know that data yet. And secondly, it's not clear whether those individuals are able to be free of reinfection and whether they're actually able to be free of potentially being infectious to others. So those are some unanswered questions. I think as these new tests are being developed to check the antibody levels in people, and hopefully coming soon, those kinds of studies can be done to help us really get to a better understanding of those questions. Thank you.
Thank you again, Doctor. And great question, Alessa. Really appreciate you. Thanks for that question. Reminder, you can, this is the last call for emails. If you want to give us your email address, now's the time. There's still a few people waiting in line, but you can press 7 if you'd like to give us your email address for updates before the end and get updates from Congressman Lieu's office. Next up is Nancy in Torrance. Nancy, you're live. Go ahead, please.
Hello, Congressman Lieu, and thank you, panel members. I am presently consulting with a firm that is ready to manufacture this much-needed PPE, and we want to do it locally. We want to hire people. We are ready to go. However, we are looking for assistance in establishing, for example, I know it's an exception, but to create a foreign trade zone for our facility because many of our inputs come from overseas. And if we can streamline the import and the customs process, it would help us greatly. And I'm wondering, not only that, but 2, we have a new proprietary technology, which I really think will be, which is better than current medical PPE. And we'd like to have some help streamlining and fast-tracking the FDA clearance and the NIOSH approval process. And I'm just wondering what either your office or what the federal government does for companies like us who really want to help this.
Thank you for, first of all, your efforts in fighting coronavirus, and thank you for your question. So our office has, in fact, assisted various organizations and individuals who had similar requests. One of them was for a particular test kit they were trying to get quick FDA approval on. And so after this call, my office staff will follow up with you to see what we can do to assist you and to see if we can get the FDA to expedite whatever it is they need to do to help you get your PPE done. So thank you for doing that, and we'll follow up with you after this call.
Thank you, Congressman, and thank you so much, Nancy. And Nancy, something you can do right now is if you'd like to leave us a voicemail message with all that information and with your best contact information, Nancy, press 9 if you would, and just leave us a voicemail message. When you're done with that, you'll be able to come right back into the live forum. So if you press 9, you can leave a voicemail with your exactly what you just said, as well as your name and the best contact info, and then we'll be able to reach back out to you. So you can press 9 to do that, leave a message, and then come back to the live forum. Let's get our next one up from Ken in Beverly Hills. Hey, Ken, you're live. Thanks for waiting. Go ahead, please, sir.
Hi. Thank you, Congressman Lieu, and thank you all for what you're doing. As far as the antibody testing, I've been sick for many days with symptoms that I find to be conducive with coronavirus, and I'm on the mend now, but when I try to get tested, it seems as though I don't fall into the qualifications of being over the age of 65. And I was just wondering if there is antibody testing and when that might be available.
So
that's a great question, because I've asked that question before, and there's definitely not wide-scale antibody testing. I'm not sure how effective current individualized antibody testing is, and maybe Dr. Murphy can help answer that.
Sure. So there's a lot of work underway to develop this testing, and it should be available soon. As far as I'm aware, it's not currently available. The FDA has is approving rapidly some of these new testing modalities, and so it's not widely available at this point, as far as I know. I think the question you raised, however, actually prompts another topic, and that is there are many people, as I mentioned, who may have mild infection or who may not even know it. So one of the other benefits of potentially using the antibody testing may be to screen our individuals who may have had the test and not had the illness and not know it. It might help us in thinking about the next phase of how we start slowly scaling back from the public health measures like social distancing. So we don't have those yet.
Got it. Thank you, Doctor. And thank you for that question from, we got that one from Ken. Thank you, Ken. Next one's up from Tony, who's in Malibu. Tony, you're up. Go ahead, please.
Yes, thank you. I've got sort of an epidemiological type question. Our federal officials are saying that there's likely to be 100,000 to 200,000 deaths if they do a perfect job. And I'm wondering about that because China had about 5,000 deaths, and they've passed by the worst of it. And if we did a perfect job, that would mean 50 states doing stay-at-home orders, PPE being adequate, all the kinds of things. Would it not be possible that we could have less than 100,000, significantly less than 100,000 deaths, even if we did these perfect things right now?
So thanks for your question. I'll have Dr. Murphy answer it, but let me give just a few thoughts first. The way this virus spreads is that it's exponential. And so what happens is you have not a lot of cases at the very beginning, and then it accelerates very quickly. So, for example, at the beginning of March, we had about 70 total cases of coronavirus in the U.S. We're going to exceed 200,000 cases today. And you see in just a matter of 1 month how quickly it's spiked. And we now have more deaths from coronavirus than from September 11. And so it's somewhat, I think, difficult for folks to then go, well, what happens in 2 months? Because if it keeps on going exponentially, you get quite outrageous numbers. The hope is it doesn't get there because of social distancing. It's very hard to know because a lot of this does depend on how effective these measures have been and there's also a time lag between the measures being taken and the cases we're seeing right now because of the potentially long incubation period of this virus of anywhere from 2 to 14 days. So there's just a lot of unknowns out there, but what the modeling suggests is we could very well have over 100,000 deaths by August. We could also have less. It is very difficult to know because when you have a nation of over 300 million people and 50 states having different versions of social distancing, it's very hard to understand exactly what's going to happen in a few months. And Dr. Murthy, do you have any other thoughts on that?
No, I think you explained it beautifully. The only other thing I might add to those comments is that all of the modeling data that you referenced really helps to illustrate that the most important reason for implementing these measures is to slow the speed of spread so you don't have the healthcare systems overwhelmed and buy some time to be able to develop vaccines and treatments. And as this time goes by, that even though there may be a blunting or flattening of the curve, that overall the number of cases may not actually be a lot less over time. You're just spreading it out over time to allow all the other systems to be able to keep pace and get ahead and shore up. So I think the numbers about the projections may not be lower than originally predicted. It may be somewhat, but the important thing is that it won't all happen at once. It's going to spread out over time.
Yeah. And at that point on buying time is very important because with time you can get closer to a vaccine or drug therapy. And that I do have a question actually for Dr. Murthy. We've seen in the press reports about hydroxychloroquine, the anti-malaria medication. My understanding is there has been a study in France that seemed to have good results, but there was also a study in China. There was a controlled study that did not show it had any effect. Do you have any? Could you provide any light on this medication and whether it might be effective or not?
I think, like with any other scientific question, it's important that we have a good understanding of how the study was done and whether the data are compelling. And we rely, at least in most scientific inquiry, to make sure that we have well-done studies, and ideally those are randomized controlled trials. And there are a number of those going on with these agents as well as with some investigational agents. And that's the best way for us to get confidence. On the other hand, using existing drugs like this based on these, what I think are at present somewhat unvalidated reports, raises a concern about overusing it with drugs that may have side effects. So I think there's a real concern around endorsing these studies that are not necessarily conducted with the most scientific rigor.
Thank you.
They're not recommended.
Thanks again, Doctor. Thank you, Congressman, and great question. Appreciate it. Let's get our next one up right away from Carol in LA. Carol, you're up. Go ahead, please.
Hi. Thank you so much, Congressman Lieu, for doing this for all of us. I just randomly picked up my phone, and I was so happy to be involved, so thank you. My question is about another caller had asked about independent contractors and being not able to get unemployment. And so I am also one of those and would like to be contacted as well if that's possible.
Yes. And operator, can you tell her how to provide her information so we can contact her?
Yeah, absolutely. So what you can do, Carol, is you can just press 9 right now and leave us a voicemail message with your name and your contact information and reiterate your question. So again, Carol, if you can press 9 now, leave us your contact information, your name, and the nature of your issue that you're having, and we'll absolutely reach back out to you. If you press 9 to leave that voicemail, you'll be able to come right back into the forum when you're done. All right. Thank you, Congressman. We've got another one here for you. This one's from Barbara, who's in Redondo Beach. Barbara, you're up. Thank you for waiting.
Yes, thanks for taking my call. I'm a veteran, and I'm concerned about the lack of information flowing from the Veterans Administration. I haven't heard anything about how they intend to coordinate care for veterans. not one thing have I heard, and I listen quite a bit.
Do you currently get care through the VA?
Yes.
Okay. And so, first of all, I thank you for raising that issue. I was not aware of that, so we will look into it. And if you have a specific concern about something related specifically to you, again, our district office can help you with that.
Great. Thank you, Congressman. And thank you, Barbara, from Redondo Beach. Appreciate you being our last caller of the day for live Q&A. Congressman, we're almost out of time, but for Barbara, as well as anybody else who needs to leave contact information for Congressman Lieu's office to get back to you, you can just stay on the line until we get to the end of the call. We'll be wrapping up in less than 5 minutes here, and you'll be able to just stay on the line, leave us a voicemail message with your name, your contact information, and the nature of your issue. If you stay on the line, leave those voicemail messages and leave us contact information, Congressman Lieu's office will get back to you with an answer. So, again, all you have to do is stay on the line to leave those voicemails. Very much appreciate that. And Congressman Lieu, I'll turn it back over to you to take us to the close, please.
Thank you. So let me thank Louise, Victor, and Dr. Murthy for being on this call and providing your insight, and all of you for joining this call. We are in very difficult and challenging times, but I know if we work together, we will get through this. And you should know that your local, state, and federal officials are working closely together. At the end of the day, we're all Americans, and we're going to do everything we can to help each other. And I am very, very hopeful that with the help and support of all of you and of the brightest minds who are working now on a cure, that we're going to get out of this sooner rather than later. And Congress will be working on additional legislation as well to help those most impacted by this pandemic. And again, if any of you have any specific issues related to you or your family that we can assist with, please feel free to contact my district office. And thanks again for joining this call.
Thank you again, Congressman. And for anybody who didn't get a chance to give Congressman Lieu your email address to get updates, you can either stay on the line, leave it in a voicemail message with your name and clearly spell out your email, or you can go to lieu.house.gov/contact/email. Again, that's lieu.house.gov/contact/email. You can go ahead and do that, or you can stay on the line, leave us your voicemail message with your name and your email address, and we'll get you added. And again, you can also stay on the line to leave us a voicemail with any questions we didn't address during this town hall, with any personal issues you're experiencing. Stay on the line, leave those voicemails. Just make sure you leave your name and contact info as well. So thanks again to Congressman Lieu for assembling this great panel and answering so many questions and giving us so much great information today. Really appreciate the participation, of course, of the residents of Congressional District 33 in California. Thank you so much for your time. Stay on the line to leave those voicemail messages. Last thing I've got for you is if you need to get a hold of Congressman Lieu's district office, phone number for that is 323-651-1040. Again, if you need to get a hold of the district office, that phone number is going to be 323-651-1040. Thank you again, everybody, for your participation. Stay on the line to leave those voicemails. Stay safe.